Hello dear friends, this is a case of a 56-year-old female patient who presented with right iliac fossa pain, peritonitic appearance and raised inflammatory markers, and CT scan was done to rule out any possible appendicitis or other pathology. The most prominent finding in the CT scan was this area with fat stranding, inflammatory changes and possibly some traces of fluid and some reactive peritoneal thickening. We can see the cecum, and as we scroll down we must find the appendix. The appendix is here, this tubular structure. But the appendix has something unusual. There are some outputtings, one here, and one there, and goes on. And here at its base there are some other outputtings, and there is significant inflammatory changes around its base. This is a CT scan of the same patient performed 5 years ago, and we can see the appendix and more clearly these outputtings. Here, and as we go closer to the base of the appendix, here, and here. So there is no doubt that these structures are diverticular in the appendix. And going back to the current CT scan, we can see that there are inflammatory, infectious changes at the base of the appendix, but the appendix itself, it's not significantly dilated, and there is no typical wall thickening. There is also no evidence of any obstructing appendicolith. You can see that the distal aspect of the appendix shows normal wall thickness. There is no significant wall thickening, and the inflammatory changes have been developed around a pre-existing diverticulum at its base. So this is a case of appendiceal diverticulitis. It is a really very rare, very unusual case. The symptoms are similar with the typical and classical appendicitis, right lower quadrant pain, tenderness, leukocytosis. One of the risk factors in this condition is that there is increased intraluminal pressure in the inflamed diverticula, and there is higher risk of perforation. Another thing is that this condition is associated more commonly with underlying appendiceal neoplasms like carcinoid tumors or mucinous adenomas. Dear friends, thank you for watching this interesting video. See you the next time.